Since March last year, residents in long-term care homes and retirement homes across Ontario haven't been able to leave.
Chief Medical Officer of Health put out directives to homes, and one of the things that he put in those directives is that residents aren't allowed to leave the homes. Directives cannot be used to detain people. That's not a legal use of those documents.
Jane Meadis from the Advocacy Center for the Elderly says the legal way to do it is making a Section 22 order, the same order that allowed the Medical Officer of Health to make people wear masks in apartment buildings and other settings. But that hasn't been used.
If the Chief Medical Officer of Health or if local public officers of health want to detain people and think that that's an appropriate thing to do, they could make a Section 22 order. That order is appealable. Like any other citizen, you can appeal that to the to a board and determine whether or not the public officer of health or whoever has the evidence to detain you.
But even now, after most of them are vaccinated, they still can't leave, and it's taking a toll on their mental health.
We've had, so many stories of individuals who, had maybe a little bit of mild dementia, mild memory issues to the point of forgetting their loved ones when they were, reunited 6-7 months after. People who used to be mobile are now wheelchair bound or bed bound.
When the Ontario Minister of Long-Term Care was asked about this yesterday, she said even though many residents are already vaccinated, it's still early and it takes time for immunity to build.
We have to be extremely cautious at this point to make sure that we don't jeopardize the benefits that we've been able to achieve with the vaccines. And you can see the cases in BC where homes are in outbreak even though the residents have been vaccinated.